everyone! In this section, we'll discuss another route of injection, subcutaneous injection, SC, which is also called hypodermic injection. By the end of this section, you should be able to first describe the concept of subcutaneous injection. 2. Verbalize the purpose, injection sites, supplies preparation, methods and precautions for SC. 3. Practice the skill of SC in the laboratory. Subcutaneous injections are delivered into the fatter layer of skin just beneath the epidermis and dermis. This adipose tissue has few blood vessels, so drugs administered by this route have a slow, subtent rate of absorption compared with intramuscular injection. SC can be used for the following purposes. 1. Medicines that shouldn't be given orally. For example, some drugs are poorly absorbed in the gastrointestinal tract, or their rapid systemic effects are needed. In this case, we can use SC route. 2. Vaccination, such as immunizations for children. 3. Local anesthetics. Now let's go through the procedure. First, we should assess the patient's condition, treatment option, medical and allergic history. Some medicines, such as heparin, could increase the risk of hemorrhage. Then assess patient's conscious state and knowledge about the needs of injection. Moreover, we should check the sites for injection. Choose a site that is free of skin lesion, bony prominence, and one with lots of underlying muscles and nerves. Next, prepare all the supplies. We set up a tray with a sterile syringe, 25-gauge needle, and the medication prescribed. Prepare the medication administration record, MAR, antiseptic swabs, gauze, clean gloves, a kidney basin, and hand sanitizer. Some medicines are prepared with special syringe and needles, such as insulin and heparin. How do we carry out SC injection intervention? We'll now go through the basic steps. First, draw up the medication according to the doctor's prescription. 2. Identify the patient used two identifiers. Explain the procedure and the medication to get the patient's cooperation. 3. Choose appropriate sites for injection and clean it with antiseptic swab. Various sites could be used for subcutaneous injection, including the abdomen, the upper aspect of upper arm, the front of the thigh, the upper back, and the upper ventrogluteal areas. However, the absorption rates of these sites are different. Drugs injected subcutaneously in the abdomen are absorbed most rapidly, while those in the upper ventrogluteal areas have a slow waste absorption rate. So, when we inject short-acting insulin, we should use abdominal site to get rapid absorption. 4. Remove any bubbles from the syringe before administering medicine. 5. Check all the information again, and then insert the needle. The angle of insertion is based on the amount of subcutaneous tissue available and the length of needle. Usually, we spread the skin taut at the side, hold the syringe and insert the needle at 30 to 40 degrees or 90 degrees. For an obese man, we need to insert at a greater angle. On the contrary, if the patient is very thin, we can pinch his or her skin instead of spreading it and reduce the injection angle. Make sure the solution is injected into the subcutaneous tissue. Take the case of insulin injection again. If you inject the insulin deeper in the muscle, the solution will be absorbed too fast. This may increase the risk of hypoglycemia. This picture shows different lengths of needle used for SC. You can see an insulin needle is slightly shorter than other needles. So we'll insert such shorter needle at a 90-degree angle. The next step is to hold the syringe steady, then inject the medication slowly. Rapid injection may create pressure to the skin and cause discomfort. Aspiration before injection has generated a lot of controversies. Some studies show that pulling back on the plunger is necessary. However, the American Center for Disease Control does not recommend aspiration prior to injection because no large blood vessels are present at the recommended injection size, and aspiration might be more painful for infants. After the solution is fully delivered, the needle should be withdrawn quickly. Place on the injection site with a sterile gauze or swab. We should tell our patient not to massage the site because massage can traumatize the underlying tissue and even contribute to the formation of hematoma. 8. Dispose the needle in a sharp container and retract. Remember, do not recap the needle to avoid needle stick injury. 9. Dispose of all the supplies, remove the gloves, and perform hand hygiene. Document the procedure and findings accurately and appropriately. After that, we should evaluate the patient's response to the injection. Common complications for SC include severe pain, redness, swelling, bruising, and allergic reaction. One important measure to prevent bruising is to rotate injection sites. So in clinical practice, for diabetic patients, we should make a plan to alternate the insulin injection sites. Instruct the patient to keep the injection sites about an inch apart. Finally, let's summarize how to carry out this procedure safely. First, check administration rights and implement standard precautions. 2. Drops which cause irritation should not be injected subcutaneously. Third, use needles of appropriate size and length according to the patient's condition and the medication. 4. Maintain rotation of injection sites. Okay, that's all for today. Here are the references for this section. Thank you for joining us. Bye-bye.